The Nutrimedical Report, and we have Ryan here, and we're going to talk about all kinds of wellness conditions. Ryan, the whole issue of occupational wellness and functional wellness is very comprehensive. In the Dr. U book, I have a chart there, and I think you've seen it because I sent you a copy of the book. And it shows that functional medicine wellness is not alternative. It includes everything. It includes surgery, medical drugs, intensive care, imaging studies, genetics, toxicology, plasma physics, herbology, chiropractic, you name it. It's incredibly comprehensive. And because of that, we're looking basically down at the underlying metabolic problems. When you start using what I call functional nutrimeds, and really they shouldn't be even, in a sense, lumped with herbals, because they're a step beyond, where we make sure that they retain a certain concentration of nutraceuticals that are delivered over a long period of time by special biodelivery systems. They're in their activated form, which is not even like food. For example, you can have a good balanced diet, but if you can't bioconvert those nutrients in the food, you're still going to be deficient or out of balance. The thing about nutrimeds is they are all in their activated state. They're special biodelivery systems, and so they're nutrapharmaceuticals would be a better term for them, because they are high-grade delivery systems of the activated form, which is unlike other even nutraceuticals that other companies or even natural doctors give. And that's what's really important. People should understand these are physician grade for functional medicine doctors, and they're a powerful tool set that if you combine them with technology like functional medicine, blood, urine, stool, genetic testing, or the QRMA or bioplasm, you can delve into what's going on with somebody even before they get symptoms, which is really pretty cool. It means we're starting to delve into what is a functional well state, which isn't just a matter of lack of symptoms. It involves much more than that, doesn't it? So,
I mean, Dr. Bill, this is what people have been wanting. You know, they want.
Right.
One, to be able to know what's going on in their body, and two, to try to be able to correct it without saying you've got to add another medication, and give them some good options, and watch what happens when the body is nourished, how well it can correct itself.
Yeah, and a lot of time, a lot of people think, well, I got to take 20 things. No, you may only need 2 or 3 things to get you going on the pathway to wellness. I'll give you an example. Let's say you have chronic dysbiosis of your bowel and you're not digesting your food. Digestease, which restores pepsin and stomach acid, and Gastrozyme. And then to get rid of pathogens, berberstatin, allicin med, and then Living Probiotic, which is a Result 6 strain Living Probiotic Ultra, the most powerful probiotic. And things to heal the gut, whether it's just hiatal hernia or gastroesophageal reflux or acid pepsin disease, or we call biogastritis, where you're getting reflux biogastritis in the duodenum. GastroHeal will do the trick, and you don't need drugs. And if you're trying to kill off pathogens, if you can do a QRMA test, or you can actually do a CDSA2 test, send the kit in yourself after you order it online at labtestingdirect.com, and you can find out that our protocols work, and they're actually non-toxic, safe. So a lot of the drugs now basically are passé. Proton pump inhibitors like Prilosec, drugs like anti-inflammatories, when you compare it head-to-head with Inflamex and Cell Defense, these drugs are dangerous. They can reduce things like heart attacks and other problems like gastroesophageal hemorrhage and so on. And when you take the natural molecules, you don't get side effects and you get better results. It's amazing, isn't it? And we have people that have everything from cancer cachexia. I've got the protocol up in front of me now, where they're basically losing their muscle masses, going poof because they've got cancer. And cancers can then generate molecules that change your body metabolism, cause muscle wasting. So you take Mega Muscles powder along with Sports Energy Light. You can add D-ribose, which I'm renaming ATP Energy, and ALC 1000, which I'm renaming Cell Energy. And we use Mountain Red Velvet, Malignant Arrest, which is used for both autoimmune disease and cancer, and a smoothie made of ageless life support and NutriComplete. And you can get someone that's basically wasting, along with the Mega Muscles powder and Sports Energy Light, to come back and rebuild their muscles. It's just amazing, isn't it?
Yeah, it's so neat to know that these solutions exist, and obviously when people are listening to you, Dr. Bill, I mean, that's why, they keep getting good results and learning more from you about these applications. Right. That you can take products like Mega Muscles, and all of a sudden you've literally taken a key and unlocked the muscle building potential in the body, and this is There's been some really neat studies done by Dr. Robert Wolf with regards to amino acid blends. And he's just remarkable in being able to unlock the potential that even people that are laid out bed rest, or, if somebody's injured, like with a cast on a leg or an arm,
or if you want a muscle build. Yeah, if you want to be a muscle builder and sports and so on, you want to take our Sports Energy Light along with our mitochondrial support formulas, which you have together, mitothyroid, Nutrimedical, mitochondrial catalyst, etc., CoQ10, ubiquinol, and VascuCare, which is relaunching, and IBS Care, which is a slow-release form of carnitine. One of the things that I think people should realize, I'll give you an example with cancer, is, and this is a real case, a lady who actually was 85. She had a small rectal polyp that was actually turned to cancer, but it was very slow growing because she's 85 years of age. They wanted to do full-dose radiation, chemo, and surgery. And their ultimate plan was to actually not just remove the local tumor, but to actually give her an ostomy. And, of course, at that age, she's very fragile. She would probably deteriorate and die prematurely from the treatment. So what we recommended is a modulation of that. She did go through some chemotherapy, but we rescued her with our Malignarest, Malignablock, ellagic acid, Inflamex to strip off the fibronectin capsule of the tumor. And we just had them remove the local polyp and tumor without doing an ostomy, and she's done fabulously. We rechecked her, and she's, we may not cure her, but we're going to prolong her life so she won't be miserable with an ostomy for the last number of months of her life, and she's not going to go through a collapse of her immune system or bone marrow and die of an infection or other problems. Apparently her latest PET scan shows that with our nutraceuticals, including Malignarest, we've kept the tumor at bay so it's not returning, and she's doing fine. So this is a good example of the application of kind of common sense. You don't take your treatment so aggressively that a fragile person, 85, who's, by the way, the older you get, the slower your cancer grows, it would be literally terminated prematurely and very viciously by overtreatment. And we've taken a middle road to say, hey, you got to do some chemo, and we tried to recommend alternative chemo, but they want to do regular. And, gene-based cancer therapy is always the best. But they did that. We were able to rescue her even with conventional care with our protocol. Well, Malignarest, Malignablock, high-dose power, CFO, vitamin K2, ellagic acid, etc. So, in other words, we can find a pathway to help you no matter what. If you're going to go to conventional treatments, or let's say you do surgery and you've got bones that aren't really strong. If we don't strengthen your bones or keep them strong, those appliances they put, let's say a hip replacement, will shatter the shafts of the metastasis of the femur, and you'll be really in a mess because now you've got a femur that's been shattered, so you can't have a proper appliance put in there, and you're basically stuck in a wheelchair without a hip. We need to strengthen your bones, and 42% of the dry weight is collagen, so you need things like Collagen Max, Tendon Mender Joint Performance for your joints, and Mountain Red Velvet. And if you take the right things along with technology to stimulate the stem cells like, Lumen Photon and Micropulse, you're going to regenerate the bone and strengthen the bone, not just increase its density. A good example of a simple protocol is Candida. Women with recurring Candida or recurring dysbiosis, berberstatin, living probiotic, and a douche with Nutriodine or Silver 100, and taking Allison Med. I love Allison Med. I take at least one capsule a day. I call it cellular hygiene. A lot of people don't realize a lot of pathogens that get inside your cells. Spirochetes, mycobacteria, fungi, and viruses. They get inside the cell and start messing with your DNA. Cardiomyopathy, people that have heart failure. Recently, I think she was 94 when she died, Reagan. And even in an elderly person, if you support their mitochondria in their heart and their blood vessels, you can prolong their life or improve their quality of life tremendously. Back. Ryan, I'm constantly updating the protocols, and I'm working now to actually embed video with both live stream and YouTube video to put in more medical references, more information, so it becomes more of a platform. People that have access to it are elite customers that have purchased 6 times in the last 12 months or $1,000 an order. By the way, everybody who emails me, even if they've never ordered before, I will email you back the starter protocol to help your condition. You don't have to have a membership or order before or anything. But you don't get a phone call back unless you're one of our elite customers. If you're one of our elite customers, I will call you back. And there's no charge for that. The only time your charge is you start to inundate me with, like, dozens of records and MRI and CT and PET scans and stuff, and you say, Doc, I need help. Even act as a mentor or medical legal consultant, I'm going to charge you a phone consult time based on units of half hour. But other than that, everything's free. If you're an elite customer, you just email me, anybody, and if you've actually placed 6 orders, even if it's just $20 an order 6 times in the last 12 months, I will call you back. That's pretty cool. I don't think anybody else does it. This is, I consider, a ministry. So people need to know that. And by the way, the free Dr. U book was just a 24-hour special I put on yesterday, and we did get some people that ordered it, and that was very thank you. And I know you'll enjoy your book. Those people who have QRMA machines, you should send me your QRMA along with your kind of a summary of your current history, what things are better, what things aren't. And I'll look at your QRMA. In fact, if you wanted me to compare this one to a previous, just send both, and I'll compare them and tell you what nutraceutical changes you need to make. A lot of people aren't aware that your nutraceutical changes occur pretty quickly. Usually in 3 to 6 months, you'll see a dramatic change. Most people that are on our QRMA testing, along with our Nutrimeds, within 2 years, they're down to about a third of what they previously were on, because they actually start to fix problems. They're on lower dosages, and they're off some things altogether and just on different things that they may not know, but the QRMA or the functional medicine blood and urine and stool testing will actually tell us they need to change their protocols. And the problem is you can't base it on symptoms. It has to be based on functional medicine testing and bioplasmatic testing, like the quantitative resonant magnetic machine or the bioplasm. The QRMA is quick and dirty. You just do the test, send me the compressed file. Cervical, thoracic, lumbar pain, spinal stenosis. And I see a lot of people rushing off to either do major surgery, which I say, no, please never do that. If you have to do anything, do keyhole surgery. One of my colleagues that I was on a national IRB pain research panel, Dr. Centeno, has a clinic in north of Denver, in Broomfield, and him and his colleagues have actually set up a stem cell clinic in Grand Cayman Islands for spinal and paraspinal injuries. They take your bone marrow, multiply your stem cells, give it back to you within 2 weeks. You stay there for vacation. They give you stem cells back, and they do it under C-arm so they can actually see where they're putting the needle in a specific joint, like your hip joint or a lumbar vertebrae, and they can regenerate your tissues. But you need to have the right nutrients. And if you go to a Centeno, which I can arrange, you need to take Collagen Max. You need to take Inflamax. You need to take Tendon Bender, Joint Performance, and Mountain Red Velvet. You need to take the phospholipids to rebuild tissues, Nutrifos, Neurogen, and Vitamineral Max Minerals Plus, and maybe Copper Regenamax if you need extra copper, based on our QRMA testing. Because if you don't have these nutrients, you don't have the building blocks to rebuild the tissue. So it's nice to have stem cells, but if you don't give the stem cell support, it's not going to work as well. It'll work 30% as well as it should have, or 40%, but not 100%. So, Ryan, let's talk about people that get chronic pain. A lot of time they don't realize, too, that it's not just an anatomic encroachment. It's inflammatory change to the nerve sheath, the dural nerve sheath around the nerve, that's stimulating the pain receptors in the nerve sheath, that's causing it because of the disc material. This is very inflammatory. It releases slow reactive substance of anaphylaxis, bradykinin, neurotenins, etc. And one of the most vile is IGF-1, and the big bad boy is tumor necrosis factor alpha, which you can actually do an aspiration at the transforaminal area of the nerve and actually see the TNF-alpha levels going right through the roof. People need to know the most problem is a chemical and cytokine inflammatory pain-induced reaction. It's not an anatomical encroachment. So when you see the spine surgeons kind of salivating when they see an abnormal MRI, 43% of males over 40 have an abnormal MRI that if the surgeons had no restraint, they'd cut, which is crazy. And most of the pain, 95% of the pain, is not anatomical encroachment. It's inflammatory changes to the dural nerve sheath. You need to know that. In other words, this is an inside, what I call inside info on the business of how the surgeons make a lot of money. Crazy, hey?
Yeah, it's a little frightening.
It's what's called truth in journalism. And, for example, I did research with a research radiologist back in Denver, and we were starting to do research on what's called flexion extension lumbar and thoracic and cervical MRI scans, because a lot of time, unless you do a flexion extension, you don't know that there's a spinal nerve root or spinal cord encroachment by spinal stenosis or encroachment of the neural foramen at the exit point where the nerve exits. And a lot of people make all kinds of assumptions. The reason why I'm good at what I do is I asked a million questions, even of these so-called specialists, and say, my gosh, Deagle, let's do some research in this. And I was talking to the top radiologist running the Denver Imaging Center that had hundreds of radiologists there when I was working with him. And we were doing the selection extension MRI scans, and we found most of the people where they were doing anterior and posterior titanium cages had no business doing it because it didn't prove there was any caudal equine encroachment. It's like these surgeons had no business operating and doing this because the patients had something like a diabetic neuropathy or some other problem, and doing an anatomic surgery was unreasonable. And all they had to do was start taking things like our nutraceuticals and perhaps doing lumen photon or micropulse or mild hyperbaric oxygen to get the pH up, take high-dose Power C with full vitamin K2, Inflamex and Collagen Max tend to amend joint performance, and their body over the next few months would just gradually heal it. You know, it didn't matter what the underlying cause, whether it's an osteoarthritis, a inflammatory arthritis, or a diabetic neuropathy. It's disturbing to see wrong-headed approaches that are aggressive, that don't need to be used, when a patient will heal if you just give them time and the right support. Interesting, hey? So let's look at chronic fatigue. Cognition Plus, BioLVR, those are two biggies. Why are these so good? Well, you need to bioconvert your neurotransmitters. Also, I'd add to that list Minerals Plus, because the particular minerals in Minerals Plus are particularly good for reversing chronic fatigue. So Cognition Plus, BioLVR, Minerals Plus. Let's talk about why they're going to reverse chronic fatigue syndrome.
Well, the activated forms of the nutrients that are found in those formulations, Dr. Bill, make a huge difference. A lot of people have taken nutraceuticals that have similar ingredients. They look at it and they go, I think it's kind of the same, but oftentimes they're misled just by things like the B vitamins that are in there, need to be in activated forms, or the dose levels. You got to have them high enough that they're going to make a major impact in the body.
Exactly. Yeah. By the way, a lot of time people should realize that usually the first and second hour on Monday, the second hours on Tuesday, Wednesday, and now the first hour on Thursday, the first hour on Friday, and the second hour on Tuesday, Thursday, and Friday, we talk about nutraceuticals. And by the way, you want to listen. Always don't go to GCN Live because it's confusing to find all the different things. Just go directly to Nutrimedical.com. We'll bring you directly to the right page for Listen Live, or go to the archives. We have nice little buttons there. Go to Nutrimedical.com to the Listen Live or the MP3. One of the things that I often get is people wanting to do something for their kiddies. And I tell people, make a smoothie. Use Ageless Life Support NutriComplete, which is fantastic. It's the reds and greens, all the goji berry, etc. Put in a teaspoon or tablespoon of omega cod liver liquid and open some capsules of Bone Generator. To give you all the nutrients you want. I mean, literally all the vitamins and Vitamin Mineral Max, Minerals Plus are present in Life Support. You got the immunoglobulins and the anti-aging molecules and DNA repair in the Ageless. And NutriComplete are all your reds and greens and veggies. I mean, so what could be better? If someone has high cholesterol, for God's sake, don't use an HMG-CoA reductase inhibitor. I still see cardiologists, even quote alternative ones, saying, well, if you're on Zocor, Lipitor, Crestor, keep taking it. It's like, are you crazy? They obviously don't know the physiology of what causes plaque, and I'm just going to go over this very briefly. First off, you end up with oxidized cholesterol called 9-noronyl hydroxycholesterol, or oxidized fatty acids that, if they're heated, they become a trans fat. Then the big eater cell, or macrophage, eats those little globules, and they die and become what's called a foam cell. They release soluble ICAM-1 and 2 and vascular activation factors like TNF-alpha and IFN-gamma, and they form and cause a precipitation of fibrin and platelets, and then there's another layer of dead macrophages that eat those little globules of oxidized fatty acids, and they die, and you form what's called a unstable plaque, which, because of the nature of it, starts to calcify. Now, if you do a high-speed CT scan, coronary angiography, which takes 8 seconds, it's no big deal, there's not even any catheter up in your heart, you can do 8-second high-speed CT, it'll tell you exactly which arteries in your heart or your circle of Willis in your brain are calcifying. Now, you can reverse that with high-dose Power C, full vitamin K2, ellagic acid, and omega supreme krill, and also Vein-Away, which actually, the diosmin will actually reverse the calcification of plaque and also damage to your nephrons if you're in your kidney. and the small vessels in the back of your eye. So if you're trying to prevent your eye from losing the circulation, again, remember lowering intraocular pressure for glaucoma or wet or dry macular changes, the most important thing is to stop the oxidative stress with things like Omega Supreme, krill, Omega Supreme, and things like cell detox, glutathione, Nutrimedical, Regenerex. So, lowering cholesterol is real simple. Omega cod liver liquid, Omega Supreme krill, ellagic acid, Neovasc, which will lower triglycerides levels. It's so simple to do this, and head-to-head, actually, Omega cod liver liquid will lower cholesterol just as much as cholesterol, but it won't lower it too much, you see, because cholesterol isn't by itself bad. It's whether cholesterol becomes oxidized, because it's a very good patch. If there's any oxidative damage to a blood vessel wall, the best patch for damaged endothelial lining of your vessels is cholesterol. That's why it's there. So if you lower it too much, you actually increase the risk of damage to endothelium without the ability to kind of patch that damage and prevent further problems. So cholesterol is wherever it has to be. In fact, 2/3 of the dry weight of your brain is, guess what? Cholesterol and phospholipids. Is that ever weird? And so when you start reducing it, you actually reduce the ability of the brain to myelinate nerve fibers for saltatory nerve conduction. That's why if you take cholesterol-lowering agents, you can become demented. Transient global amnesia. We had Dr. Graveline from NASA 4 or 5 years ago on a program talking about his experience with going through this horror of taking these drugs and becoming temporarily demented. He couldn't even recognize his wife. Orion, we know it causes blockage of CoQ10, but people say, well, just throw some CoQ10 in there. It's like, don't take this stuff in the first place to screw up your mitochondria in your heart and your brain and elsewhere. So Omega cod liver liquid, let's talk about that for a minute, Ryan. And Omega Supreme, which is a very unique form of omega fatty acids. This is small fish from Norway, processed right on the ship. Omega Supreme krill, the only supplier in Antarctica. Our krill oil has 2,000 micrograms of astaxanthin compared to Mega Reds that has only 117. I mean, let's put it this way. If our supplements were a runner, it would be like Usain Bolt, who doesn't even break a sweat when he beats everybody else in the Olympics. So let's talk about these omega fatty acids for a minute and phospholipids like Nutrifos and Neurogen.
A lot of people are certainly aware that they need to use some forms of omega fatty acids. And fish oil usually becomes most popular, as Americans typically don't eat a lot of fish. They get out of balance cell membrane. But that the Omega Supreme is really a great formulation because of the strength of EPA and DHA you can find per capsule, which basically is guaranteed at expiration, 900 milligrams guaranteed at EPA and DHA per capsule. That's about 3 times what anybody's going to find in their typical health food store fish oil. And then Omega Supreme krill, that formulation, is a powerful one in a different format. It's not so much that it's delivering the highest levels of EPA and DHA, although EPA and DHA exist inside krill. What krill delivers is the fact that its entire package is built as a phospholipid. Nature has designed it. It can go into basically any cell membrane in our body, which is huge. And then it also delivers, besides the EPA and DHA, it delivers astaxanthin. Astaxanthin is considered one of the strongest antioxidants. Very unique. It actually spans the cell membrane from the outside lipid layer to the inside lipid layer. It spans it almost like a bridge across. There's nothing else that they've seen that ever does this. It means it creates protection on the outside, inside, and through the middle of cells. It's a fascinating compound. And as you said, the top-selling brand of krill being sold in America has virtually zero, self-admittedly, on their label of this even in the product. And that was at time of manufacturing. And then they would, kind enough to tell you that even if you measure this later, there may be nothing in there. It says it right on the label. Whereas, the formulation like you get in the Nutrimed line, you're talking not 17 micrograms at the time of manufacture. You're talking per capsule, 1,000 micrograms per capsule at the time of expiration. And that's the kind of potency you're looking for. And not only is it the potency, people need to be very, very aware. And this goes across the line for all the oils, as you're saying, the purity, Dr. Bill. These oils become certified for their cleanliness, and they don't have to just meet like global standards. These have to be drastically lower than what's acceptable standards for things like anisodines, peroxides, heavy metals. Why? Because the lower you get those levels, the less inflammation response you'll get in the body. And so that helps you to get results faster and better than what you're looking for. So people need to be aware of that. It's buyer beware. They better know what they're getting. And for the Nutrimedical line, you're not going to get anything more clean or more potent. You did bring up the phospholipids, and you talked about the brain and all that. One of the things, NutriPhos is a very unique formulation of the line because it is an absolute 100% purified form of phospholine. And that's important, as you were saying, making up the brains. But it makes up, in every organ, it makes up basically the DNA, the nucleus that contains the DNA, the mitochondria. It's all wrapped in these phospholipids. And so as you were saying, one of the things with cholesterol, not taking the cholesterol meds, can be very important to protect the integrity of the function of like the brain. And thing is, as we age, we lose this phospholine component, and then we replace it with other components that include more cholesterol, that include other components. They're kind of bandaging the cells together. And so one of the things people need to be aware of, if they've never supplemented with purified phospholine, that is really an important thing for a lot of people need to do beyond just using a fish oil or even a krill. Particularly if they have any kind of organ damage or liver enzyme elevation. This is really important to rebuild the structure because that phospholine makes up 50+% of the cellular membrane. Fish oil, even in a really healthy person, might make up 10%.
Exactly, yeah.
So you got all the tools.
One of the issues that we're starting to get new science, we've talked about this several times before, is heart and vascular disease. The two areas of medicine that are particularly deadly to the public that are not based on good science is oncology for cancer treatment and cardiology. Most cardiologists, if they actually read their own published literature by PhDs that are also, in many cases, cardiologists or physiology scientists, have shown that the theories of the big pharma companies that are using drug-based treatments are wrong. And we'll talk about that when we come back, because reversing things like, coronary vascular disease, migraine headaches, stroke, peripheral vascular disease, and heart failure, most of the treatments they have actually compound the problem rather than fixing the underlying problem. We're back. One of the things I did back in medical school is I actually would do volunteer to do percussion and help little kids with cystic fibrosis and even teenagers and young people. And they got very thick mucus. Most people don't realize asthma, rhinovirus subclass 3, and other mycobacterium opportunistic bacteria like Klebsiella, Proteus mirabilis, etc., and just normal strep pneumonia can occur in the airways. But these chronic inflammatory changes will cause fibrotic changes and also bullous changes where you lose alveoli in the lungs. And with cystic fibrosis, you're always sitting a duck for a really big bad infection that's going to take you down and destroy a bunch of lung tissue. So I tell people the first thing is hygiene, our big three: Nutridyne, Allison Med, Silver 100, inhalation. Cell detox glutathione, this is one of the ones that I think is really underestimated in terms of turning off inflammation in any tissue. The brain, the heart, the blood vessels. If you're diabetic, you need to be on high-dose Power C, full vitamin K2, ellagic acid, malignant block, because there's DNA damage also to the DNA of mitochondria. But one of the most powerful things we have, and I even tell people, grind up a capsule, you open up with cell detox glutathione and put it in your MyPure Mist, Sinupulse Elite, or Omron, and take it orally. Use Inflamex and Cell Defense, because inflammation is the underlying sine qua non of chronic asthma, chronic lung disease, bullous emphysema, cystic fibrosis, and asthma. And there's always a stealth infection of viruses, bacteria. I call it a pathogen soup of every kind of nasty pathogen you can imagine. It's not just bacteria. It's viruses, fungi, intracellular organisms. It's a whole mess. So
yeah, that's a good way to say it. A milieu, a soup.
It's toxic soup. And, of course, when tissue starts to get weak, it also tends to pick up not only pathogens but also heavy metals and biotoxins, which further cause lung damage. Yeah.
Yeah, I was just thinking that, like Kelormax and things like that. They're so great.
Right, and xenoestrogen detox. A lot of people say, well, how does someone get lung cancer? I say, well, if you're smoking and you're absorbing biotoxins that way, but also if you work in an industry or just live in the environment, the amount of lung disease is going up, although the level of pollution has dropped since the 1970s. The number of people dying of lung cancer, part of it's caused by ground level ozone, the specific type of toxins that are in the environment. and the fact that people don't have the antioxidant protective systems, like their selenium levels low, so we recommend Minerals Plus as well as Vitamin Mineral Max and selenium cruciferate and cell detox glutathione. Their antioxidant systems aren't up to snuff.
Well, I don't think they don't. We know they don't methylate well. There's disruptors or nutrient deficiencies. So right there, the engine just doesn't even fire properly on virtually any level. And so,
for
as you're saying, antioxidant hiccup, disruption of the NERV2 pathway for communication. That's really critical for recognition of, saying, inflammation, toxins, regulation of detoxification pathways and regulation of your own antioxidant generation, including, you've talked about many times, glutathione. So cell detox glutathione is, for some of these people down the road a little bit, it's pretty critical for them to get back online. And then Regenerex, I think when people look at, sort of what is the best antioxidants, what science is saying is you're not necessarily looking at the formulation like your typical vitamin E, vitamin C type thing. You're looking at compounds like sulforaphane glucosinolates or methylated resveratrol or curcuminoids or green tea. And why you're looking at those is they're not just giving up an electron to quench a free radical. They're literally reprogramming the way your cell can identify the challenges it faces. So it has the ability to then look and go, you know what? We will use what's known as the antioxidant response element, ARE, which is hugely cited now in medical literature, because they're realizing, like, hey, you know what? These cells all have their own defense mechanism, and they can protect themselves as long as they know what they're fighting against. And it's revolutionary to know that that's what's happening, and why some of these substances that have been used even for thousands of years are as powerful as they are. They've been basically helping to recognize and regulate what's known as the NERV2 communication pathway that then leads to the cell's ability to use the antioxidant response element. And so that's where you get Regenerex. And you talked about it before, the xenoestrogen detox. What's beautiful about that xenoestrogen detox is we're bombarded by estrogens of all sorts, the chemical-based ones from outside our body, xenoestrogens, or internally the ones that we are exposed to or produce ourselves. And that formulation also has all those greatest hits from Regenerex inside of it, along with things like calcium D-glucarate, selenium, the activated folate, and other things that protect the tissue from these either xenoestrogens or our own estrogen.
Right, when we see things like brain cancer, pancreatic cancer, breast cancer, bowel cancer, most people don't realize the part of the problem is you got deconjugating bacteria in your lower bowel that re-release the toxins, but you also have inability of the liver to properly methylated, sulfonated, or glucuronate. That's why we have life support. That's why we use NOestrogen detox, Samethyl, which is really important. I take a sachet every morning. It's really important to say Samethyl, because it's going to pull in heavy metals, it's pull in toxic chemicals. In fact, we had firefighters back in the emergency department as many as 30-some years ago. We would actually give them a bolus of acetaminophen methionine. It's nowhere near as powerful as even our sublingual one we have now. And we would literally pull them out of a toxic shock state where they were exposed to so many chemicals they were in cardiac arrhythmia. And we would yank them right out of it, even faster than dialysis, if we just gave them acetaminophen methionine.
I think there's two things right there. The acetaminophen to directly affect the methylation, like you're saying, so the engine starts firing. And like you said, maybe it's a drastic thing where you got to pull people out of a really toxic situation. But the other one that goes right along with that, hand in hand, is really that NutriPhos and delivering the phospholine for repair, whether it be liver or other tissues in the body. And so, for people that are really challenged, those two things together are remarkable, what they can do.
Now, let's talk about some other interesting things. We have people with deep vein thrombosis. The first thing we talk about is our cardiovascular nattokinase. This is really important. We do have lumbar kinase, but we have to special order to get it for you. But the nattokinase is something, if anybody's had a previous vascular event of any kind, there should be a nattokinase, and they also can do a test called a rheologics test, which is a blood viscosity test. Your blood can be sent off to a rheologics lab that measures blood viscosity. And this is more advanced than just measuring fibrin degradation products or PT-INR or platelet levels and so on. It actually measures your blood viscosity using non-Newtonian fluid dynamics and dual lasers. And it's very accurate. In fact, the best marker, whether you're going to have a vascular event, is not the calcium score, which is really good, or your platelet level or your FTP. They're all contributing factors. But the most important overall converging factor, including antibody levels and the levels of antibodies in the outside of red blood cells, have changed the Rouleau formation and other things, is a rheologic test. If your blood's thick, you're going to clot. That's the way it is. And if it's thick, we can reverse it, start with nattokinase. And then, of course, we can also reduce the oxidative stress in those vessels with Omega Supreme, which cuts blood viscosity down tremendously. In fact, Omega Supreme 2 in the morning will cut heart disease and stroke, heart attack, and deep vein thrombosis by 50% without even adding any of our other nutraceuticals. That's why I tell people, I say, if your mom or dad or yourself is getting into trouble, start taking our heart protocol, cardiovascular, Omega Supreme, Supernox, start taking magnesium glycinate, malate, start taking things like the gamma E+, which is the gamma tocopherols to stop hydroperoxy, nitroperoxy radical with the cell detox glutathione, and if you're diabetic or have elevated hemoglobin A1C, Nutritrala, and carnosine. There's no excuse for this because we can reverse the inflammation so nicely, and the diabetics are prone to, say, tendinitis and capsulitis. That's all inflammation. And once we reduce the hemoglobin A1C by raising SOD, superoxide dismutase 1, and it's actually in my formula NutriDefense, and you use Nutritrala and carnosine, and you turn off the inflammation with cell defense and Inflamex, the tendinitis just goes away. People say, well, how did that work? And, of course, diabetics are real prone, along with people with inflammatory changes, to interfascial adhesions and nerve entrapments like thoracic outlet syndrome, carpal tunnel syndrome. These are, I call, sentinel signs. If you're getting carpal tunnel syndrome, it means your interfascial inflammation is too high, and it means something bad is happening inside your body. Most of the time, those people are pre-diabetic or have insulin resistance or polycystic ovarian syndrome or some inflammatory change happening in their body. And we can reverse that, and we can prove it with blood tests, urine tests, imaging studies, and other ways. But again, most people don't want it. They just want to know we can do it rather than spending a fortune to do it. But they need to know, if you're curious, Dr. Deagle can prove it to you, that what we do here at Nutrimedical is unique and powerful and non-toxic and doesn't involve toxic polypharmacy. Thank you, Ryan. We will see you again.
Thank you, Dr. Bell.
I think we'll see you again a week after next on a Monday.
Sounds good. Thank you.
You take care and have a wonderful time, and we'll be back in a moment with my oldest son, Matthew Deagle. He'll be here, and Tim Alexander. We hope this is the coming up tomorrow is the 5th anniversary of 311 Fukushima.eg, and I'm going to talk about specific issues. Today, we're going to talk about geopolitical things with Matthew and much more.